let's see if we can get this going. Happy Father's Day. It is Sunday, June 16th of 2024, and it's time for another live IC support group meeting. Sorry, I'm a couple minutes late. Actually, I had flowers that I brought in, and then I realized that they were starting to bother me, so I had to go take them out. So we have a clear background back here. Anyway, my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I do live support group meetings. I've been doing them for many years now. My goal in doing these meetings is to make you so strong, so knowledgeable, and so informed that no one can mess with you again. I don't want anybody saying that you're damaged goods. I don't want anybody telling you that there's no hope. I don't want anybody taking your joy away. You're hurt. Whether you have interstitial cystitis or bladder pain syndrome or pelvic pain syndrome or pelvic floor dysfunction, you are hurt. Now, here we go. We're simulcasting, so we're broadcasting on Facebook and we're broadcasting on YouTube on two separate computers. Let's see here. It's Father's Day, and so normally when I do these meetings, quite a few people watch them afterwards as compared to during. So let's just see. Sometimes they go for 5 hours, sometimes they go for 1 hour. Let's see where the wind takes us today. That's our goal. I am letting everybody know that I will not be doing support group meetings in July. Hello, Kayleen. I will not be doing support group meetings for the rest of the summer because I am facing pretty major surgery in early July. So send me lots of comfort and support because it's going to be a rough go for at least a month or so, but we're going to get there. So I have a lot of stuff that I want to share today. A lot of stuff that I want to share. So hold on one sec. Let me just clean up okay. So the first thing is that our spring magazine, the IC Optimist, was released. For those of you who are members, it is in the mail to you now. If you can also download it right now on your member page here on the IC Network website. This is where we do our best work, is in our magazine. So in this magazine, this time, we shared all the new information on IC at the big national conference earlier this year. We talk about some new research with InterStim and neuromodulation. We share the story of an unusual case of bladder pain with new pelvic floor treatment guidelines, many more things. So if you're looking for info, come on over to the IC Network and you can get our magazine. And I just saw a typo on the cover. That's not good. Life. You know what? I'll tell you, I've learned as I've gotten older that perfection is not really an option, that there are moments when things just happen. And I can remember sending out an email to about 40,000 people. And I worked so hard on it. I was so hard on it, right? Over a period of a couple of days. Sent it out. Typo in the first sentence. So I just got to go with the flow. You know what? It's okay. Now, normally when I do these meetings, hi, Erin. I'm doing okay today. You know, I'm managing my stress and anxiety before my surgery, but you know, it's not the easiest time. That's for sure. Okay, so let us take a moment first and acknowledge Father's Day. You know, one of the things that I always say is IC doesn't change your ability. Pelvic pain does not change your ability to be a mother or father, to be a spouse, to be a loving husband, a loving wife, a loving parent, a friend, etc. But men face their own unique challenges. And I'm part of the American Urology Association Guidelines Committee for the Development of Pelvic Pain. And we had one of our meetings last week. And one of the points that I think is just so incredibly important that we acknowledge and remember is that Living with pelvic pain is difficult. Looking for a diagnosis is challenging. Worrying about the future is common. Worrying about sexuality, especially if sex hurts, is a giant obstacle for both men and women who want to maintain their good sexual relationships. We also have to understand the role of trauma and or injury in the development of pelvic pain. And we're going to be talking about this in a moment because we have new research which supports that. 90% of the guys who come into the IC Network office or call me looking for information, 90% of you, if not more, maybe even 95% of you, have a history of injury trauma athletics. That you have taken trauma to your pelvis. What do we see? We see a lot of football players. We see a lot of bike riders. We see a lot of motorcycle riders. We see dirt bike riders. We see horseback riders. We see wrestlers. We see ice hockey players. We now know that the greatest risk factor for pelvic floor dysfunction, super, super tight muscles that are starting to reduce blood supply and all that sort of good stuff, is what appear to be minor traumas over time. You fall here, you slip there, you stumble there. If you're a baseball player, how many times do you slide into home base? If you're a football player, how many times do you take a hit on your pelvis? If you're a paratrooper, how many times do you fall on your tailbone when you land from your parachute jump? So one of the points that I made in our guidelines is I said, guys, listen, would you please ask primary care doctors and local urologists, just ask about sports. Did you ride a bicycle a lot? Did you ride a motorcycle a lot? Can you remember any trauma? Did you play football? Can we just ask that question at the very first appointment? Because if they say yes, then we know exactly where to go next, which is to assess the pelvic floor. And there are millions of men who have been told that they have prostatitis and an incurable prostate disease or bladder disease, when in fact it's really a muscle injury and or trauma. And the tragedy here is that they're told there's no hope, it's incurable, which is baloney. Because if it's muscle trauma, physical therapy can heal that muscle. It can heal that muscle. So one of my causes has always been to try to find those patients who have been told that they have an incurable bladder disease, when in fact they don't. And if it is pelvic floor driven, physical therapy is tremendously helpful. Tremendously helpful. So to the guys out there, the dads out there, the sons out there, we're struggling right now with bladder and or pelvic pain. I want you to carry hope in your heart. You are not alone. You have done nothing wrong. You are not damaged goods. You're hurt. You're injured. What we've got to do now is try to figure out what that injury is. Travis said, I had a crazy amount of tailbone falls as a kid that caused debilitating back pain for years. I think that's one of the biggest causes for Travis, you nailed it. Absolutely. You'd be amazed at the number of patients who have tailbone injuries, myself included. So, I mean, that's again one of those probing questions. And you know, it's also important for the patient to, I mean, like, as you just said here, you had tailbone pain that caused debilitating back pain for years. I think that's one of my biggest causes. It's so important to share that with your care providers. It's so important to say, hey, you know what? I had a really bad injury when I was a kid. It hurt for years. I have to wonder, could that be playing a role in my symptoms today? So, hi, Anne. So that's a an important message to share. And I just want every guy out there, I hope you have a fabulous Father's Day if you're a dad. If you're a son, I hope that you celebrate your dad. And for those of us whose dads have crossed the heavenly bridge, Dad, please know I love you and I'm thinking about you and I try to honor you every single day. I love you, Dad. Okay. The second thing that I want to talk about is I want to talk about constipation, because I have been working with an ICer. Oh, here, hold on a sec. John says, what else can be done by a physical therapist or surgeon if we have pelvis, hip, tailbone trauma? Well, it's going to be physical therapy, and then it's going to be really, we want to calm nerves down if nerves are involved. So kind of concept number one, is muscles get tight. So we want to ease these tight muscles because tight muscles squeeze blood vessels and nerves. Concept number two is we want to make sure that if we have a lot of neuroinflammation, that we're working hard to calm those nerves down. And that can be with palmitoyl-ethanolamide, PEA. That can be with gabapentin. That can be with other medications. That can be with some topicals, especially if you're struggling with really sensitive skin, pin pricking, et cetera, et cetera. The most important question that you want to ask your physical therapist by far is, are my muscles responding to therapy, or are they always locking back down into tension? If your muscles are always locking back down into tension, we absolutely have to start looking at bones, because what puts long-term pressure on muscles but bones. And so if the bones are funky, if the bones have healed out of position, then we might need to work with a chiropractor or an orthopedic surgeon to try to get those bones back into the correct position. Now, I am not a fan of chiropractors. I think chiropractors are way too aggressive. Drop tables, sudden movements, things like that on your lower back, neck. I have a friend who got a broken back 2 years ago. So, and will pelvic floor muscles? No, it won't. You have to work with the muscles, my friend. Work with the muscles. Give the muscles a try first. Now, remember our new pelvic pain guidelines, our pelvic floor guidelines say, on average, it's 8 to 12 visits to the pelvic floor physical therapist. Generally, they charge you if you've had 3 to 4 months of normality, that your symptoms have resolved and feeling much better. They also say that if you have an old injury, it might take longer than 8 to 12 visits to actually get some muscle response there. I was working with a patient last week who, it's always so interesting when you start probing about this. And she shared that her muscles were so tight, they could not do physical therapy. They could not even do a vaginal exam, just agony for her, because her muscles were so incredibly tight. And, for the patient, you're thinking, yeah, okay, you're not doing that again. That hurt too much. I've worked with other patients who literally have not had a pelvic exam in 20, 25 years because the first one was so traumatic. And that patient does not understand the consequences of having tight pelvic floor muscles over time, because tight pelvic floor muscles over time have a devastating legacy. And that is, they restrict blood supply and they compromise nerves. We call that ischemia. So as long as those muscles are tight, your bladder and your vulva and your prostate and your rectum, all those things are not getting good blood supply. Our goal is to get you out of ischemia. We have got to restore good blood flow to the pelvis. That is essential. So John, pelvic floor physical therapy is always the starting point. And again, you want to ask that physical therapist, am I responding to therapy, or are my muscles always locking back down into tension? If you're always locking back down into tension, then we have to look at bones. Do we have a bad hip? Do we have a bad SI joint? Do we have a knee? Is this patient limping? Does this patient have one leg longer than the other? Does this patient have an old pre-existing tailbone injury where their tailbone is now crooked? You know, the tailbone does not just hang there. The tailbone is your center and core of your pelvis. There's a lot of things that attach to the tailbone. And so a lot of muscles that attach to the tailbone. And so normally the tailbone hangs down and under like this between your legs. But if you've broken that tailbone, your tailbone could be pointing like this, which would obviously hurt when you sit down on it. So sometimes we're dealing with broken tailbones. For me, I broke the tip of my tailbone off. So I have a kind of a round nub where my tailbone was, which is interesting. Thankfully, it doesn't hurt when I sit too much. But looking at practical things like that is just really, really, really important. That's what we've got to do. So I hope that makes sense, Sean. Last but not least, we have to look at how your feet are hitting the ground. If you have Morton's toe, Morton's neuroma, if you've got a history of shin splints, I have been really struggling the last week or so with cramping. My shins are, my calves are cramping at night, sometimes both of them. And I think that's for two reasons. Number one, I'm not eating a lot of salt because I'm working on my blood pressure. But number two, I'm doing a lot of exercise. So we got to get everything as healthy as we can. We've got to get these muscles healthy, and we've got to look at foot dynamics. If you have an ankle that rolls in, ankle rolls out, that's going to affect your pelvic floor. Every stumble gets directed up into the pelvic floor. Every time you run, the pressure of the running and the impact of your foot hitting the ground is directed back up into your pelvic floor. So how your foot meets the ground is going to play a role in your pelvic health. I was working with one patient struggling with terrible, terrible IC and pelvic floor dysfunction. Terrible. I mean, she just, no matter what she did, physical therapy was not working for her. And it turns out that she was born with a club foot. So she didn't have toes on one foot. She had a birth defect. And that massively affected how her foot hit the ground. It didn't hit the ground normally, which really messed up her pelvic floor. So it's back to the podiatrist to work on something new to try to help her foot hit the ground in a balanced way. So Sue says, I started taking magnesium glycinate for pelvic floor spasm, but suffered from constipation for a while from other meds. The magnesium glycinate got rid of the constipation, but did not cause me diarrhea. That's good. There's some research on there online about the benefits of magnesium. There you go. Renee says, my therapist taught me self-care. It's not easy. It can be done. Absolutely. John, you're very, very welcome, my dear. You're very welcome. So I want to do a reminder about constipation because I'm working with somebody right now who is struggling terribly with constipation. So constipation is the bane of every adult. You know, I mean, there is a person out there who at one point in time has not struggled with constipation. And of course, you know, finding that right balance of eating the right foods and being able to have a nice normal bowel movement in the morning, you know, that's hard. That's elusive for some of us. And God forbid you be taking medications which promote constipation. You may be struggling with, you know, kind of long-term chronic symptoms. You may have to take a lot of medicine and do lots of other things to get this constipation under control if you're taking opiates, if you're taking antidepressants and things like that. Well, let's talk a little bit about the bowel for a moment. So remember, your colon is a tube. It's a tube, right? It's a tube. Food starts at the top, progresses through that tube till it gets to the rectum and you let it go. How does food move along the tube? Well, the tube squeezes it. And we call it the gastrocolic reflex. And that means that the way the bowel works is with a food in, poop out approach. This is why most people will have a bowel movement after a meal. Because when you eat food and it stretches the stomach a little bit, those stretch receptors in the stomach trigger the colon to start moving things along to make room for the food that's coming in. So there are some people who try to have a bowel movement before breakfast in the morning, as soon as they get up, and they'll be on the toilet straining and straining and straining, trying to get that bowel movement out. And it's not going to come out for a lot. I mean, sometimes it does, sometimes it doesn't. It's the daily challenge of bowel movements. It's much easier and normal to have a bowel movement after breakfast because we're triggering the gastrocolic reflex. Now, a good healthy bowel movement looks like a snake. When it comes out, it's a tube, it's flexible, and it looks like an S in the toilet. If you're pooping rocks, small hard rocks, and believe me, I've passed many of those super painful small hard rocks, that means that you're not eating enough fiber and or drinking enough water. God forbid you have hemorrhoids in your rectum. Those little rocks are going to hurt like hell. Interestingly, if your stool is too wet, when it tries to push on it to move it, it can't move it because it just squirts on either side. So you need substance, you need fiber every single day moving down your bowel to help your colon move food along. For a woman, it's 20 to 25 grams of fiber. For a man, it's 25 to 30 grams of fiber. Now, one apple a day isn't going to do it. One apple is only 4 grams of fiber. If you're a woman, you need 20. If you're a man, you need 25. You think a salad is high in fiber? No, it's not. 1 cup of lettuce is 1 gram of fiber. So I thought I'd take a moment and share the foods that I turn to keep things moving along comfortably. So an apple is 4 grams of fiber. A pear is 5 grams of fiber. A cup of raspberries, 8 grams of fiber. A banana is 3 grams of fiber. So what have I had today so far? I had an Ezekiel English muffin that was 4 grams of fiber. And then I had a smoothie that had mango and banana. And so I probably got maybe another 5 grams of fiber in that. So, you know, I'm at 9. I'm probably around 9 grams of fiber right now today. Okay. If you really want to get things moving, a cup of split peas, 16 grams of fiber. Like, you really need to get things moving along consistently. Get peas or beans into your diet every single day. So 1 serving of peas, split peas, 16 grams of fiber. 1 serving of lentils, 15 grams of fiber. 1 serving of navy beans, cannellini, northern beans, 15 grams of fiber. Whenever I cook something, like I made a chicken soup the other night, I filled it with veg and I always put peas in it. I'm very, very invested in keeping things moving along, which they did quite nicely this morning. Okay. Green peas, 1 cup of green peas is 9 grams of fiber. 1 cup of broccoli is 5 grams of fiber. 1 potato with skin is 4 grams of fiber. Whole wheat spaghetti, 6 grams of fiber. Barley, I love barley, 6 grams of fiber. Quinoa, 5 grams of fiber. Oatmeal, I'm not an oatmeal fan. I'm sensitive to oatmeal. 1 cup of oatmeal is only 4 grams of fiber. But even popcorn is good. Popcorn is 3.5 grams of fiber. So I challenge you, I double dog dare you to look at a fiber chart online. Just go to Google and search fiber chart and start counting up your fiber every day. You have to be consistent. And again, it's just adulting. And there's just no embarrassment about it anymore. When you're in your 20s, teens, you don't want to talk about it to anybody. Listen, once you're into your 40s and 50s, it's like, oh yeah, I'm struggling with that. Yeah, it hurts. Yeah. What can we do about this constant constipation and my rectal pain? I can remember, listen, I had this really young, hot, quite handsome primary care provider for many, many years. And I was too embarrassed to talk to him about my rectal pain because I used to have a lot of rectal pain before I got all my bowel movements resolved, right? And so I would always do an appointment with a female doctor if I wanted to talk to my bowels. I didn't want to talk to him about this pain that I was having in my rectum. And then finally, I was at an appointment with him about something else. And I said, Doc, listen, at some point in time, we're going to talk about my rectal pain. And he looked at me and he goes, Jill, I have Crohn's disease. If there's anybody you can talk to about your bowels, it's me. Don't worry about it. Which I thought was, and so, he offered some very wise and sage advice. So anyway, you can ask your doctor for assistance. There are some new medications that can be a bit helpful, especially if you struggle with opioid-induced constipation. There are a number of fibers that you can buy online. The favorite really is going to be an acacia fiber, a soluble fiber as composed to an insoluble fiber. An insoluble fiber would be like Metamucil. So you want to go with the fibers that are very smooth and gentle. Miralax is certainly an option. And as Sue said earlier, getting some magnesium. I take magnesium glycinate every night myself. I take it for muscle cramps and I take it for a little bit of help getting things calm and comfortable with my bowels. And as Sue says here too, squatty potties. What's so interesting about a toilet, when you sit on a toilet, is it actually kinks the bowel. And it actually makes it harder to have a bowel movement. The way our body is designed, the most effective way for you most comfortable way, provided you had good thighs, to have a bowel movement is squatting, which is why if you go into Europe and you're traveling and you go into the bathroom, there might be a squatting toilet, which is basically two places for your feet and a hole in the ground, and you're squat over it. And believe it or not, that's actually the easiest way to have bowel movements. We've just gotten very comfortable and we've been trained to sit on a toilet. Plus, if you're older and you have weak thighs, maybe you can't squat down and do that. So we have squatty potties, which is essentially kind of a stool that you can put in front of the toilet as you're sitting down that raises your feet up 4 or 5 inches. It gets your knees up. That just kind of opens up that bowel to make it a little bit easier to have a bowel movement. So whatever works, my friends. No shame. If you're struggling, please talk to your doctor about it. But I want you to dive into high fiber foods. And don't get up crazy. Don't do 50 grams of fiber a day. You're going to get, how many people when you're young, you eat too many apples or you eat too much fruit? And you've got terrible gas and diarrhea that night because you've just eaten like 50 grams of fiber. The goal here is to be consistent and modest. 20 to 25 grams of fiber a day is great. This is just what we got to do. Duncan says, I've suffered from constipation since I was 18. I eat a big salad every day and lots of different types of vegetables. I drink 8 glasses of water and I still have it. Yeah, but see, Duncan, you think that lettuce is high fiber? It's not. It's not. Lettuce is a very low fiber. You'd be lucky to get 1 gram of fiber out of a cup of lettuce. I eat a lot of salad, but the salad I eat, I skip the lettuce and I go straight for carrots, beets, beans, cucumbers, and peas, cold peas or garbanzo beans. And so I double dog dare you, Duncan, you need to count up the fiber content of the foods you're eating. And let's see if you're actually getting 20 grams of fiber a day, because I bet you're not. I bet you're not. I bet you're actually getting, I remember when I went to my IBS specialist, and she's the one who said to me, how many grams of fiber do you eat a day? And I went, I have no idea. Nobody's ever asked me that question. And she explained the 20 to 25 grams of fiber, which I'd never heard before. And she said, what's your diet like? And I go, oh, it's fine. I eat so well. And she's, kind of rolls her eyes and goes, well, I want you to go home and look at the labels and let's actually see how much fiber you're eating a day. On a good day, I was eating 6. Maybe an apple and a slice of whole wheat bread. That was that was my basic fiber intake. It's no wonder I was struggling with rocks for bowel movements that were killing my rectum and causing me a lot of rectal pain. Duncan says, challenge accepted. Yes, that's what I like to hear. Let's see how you do. I've been doing a lot of fruit and a lot of veg myself. I've really cut way back. I'm not eating white bread at all. I will occasionally have sourdough, little bits of sourdough, but my bread is Ezekiel bread. I generally eat sauteed veg with either tofu or chicken or something like that. I'm also really working on trying to get my protein intake up, but I'm not eating red meat because it's too high in fat for my missing gallbladder. So I found Oikos has a really good high protein yogurt, 20 grams of protein with virtually no saturated fat and no added sugar. And that's been a great addition to my diet. And I think that that's one reason why I am slowly but steadily losing more weight, as you can see. Sue says, I love white beans in my chicken noodle soup instead of noodle. Sue, exactly. That's exactly what I did. Duncan said, I made pea soup one day and it worked so good. I ate it for the next 3 days and I was going to the bathroom and then it stopped working like everything else. Well, you have to just be consistent and mix things up a little bit. Just mix things up. Garbanzo beans, navy beans, like literally a really good meal would be making sauteed chicken or turkey with mushroom, sauteed mushrooms, zucchini, carrots, things like that. Put in some chicken broth, and then put in something like navy beans, and then put in your favorite spices. It's kind of like a low acid chili without the tomato, but and sometimes what I will do if it's just not, listen, I'm not a high spice girl anyway. Norway, hello, my ancestors didn't grow up with a lot of strong spices like we have today. So my body doesn't like strong spices, but my body does like ketchup. So every now and then I'll throw in a teaspoon of ketchup into what I'm making too, just to get that little bit of flavor. And remember, I am pelvic floor driven. I'm not bladder wall driven. That's my phenotype. So I can do ketchup or tomato. But if you've got Hunner's lesions or you've got estrogen atrophy, you might not be able to do that so well. Gwen says, my bladder can't handle most of those foods. What, like chicken, mushrooms, zucchini, carrots? There's nothing in that that would irritate your bladder. What foods trigger you, Gwen? What foods trigger you? Angel, hello, Angel. Angel's having interstem surgery tomorrow. Girl, good luck. I hope that it goes well. I hope that it goes well for you. I encourage you to be very vocal with your doctors in your post-op recovery. If anything doesn't feel right, you tell them. You be vocal. Be very, very vocal. The challenge with, are you having the trial or are you having the permanent implant? Trial or permanent implant? Gwen says, I live on zucchini and egg whites. How about carrots? Can you do carrots? Carrots, potatoes, sweet potatoes, spaghetti squash, acorn squash, mushrooms. Oh, so Angel's having a permanent implant. Good luck with that, honey. Good luck. I really wish you well tomorrow. Okay, now we need to talk. The last thing I want to talk about is a new theory, suggestion that goes back to something that came out 2 years ago. I don't know if you remember that 2 years ago we had the publication, I talked about this extensively, of a woman who had severe Hunner's lesions and she had a severe prolapse. And when they went in to repair the prolapse, they made a remarkable discovery that her uterus was facing backwards. So normally your uterus is held in place by various ligaments. But one of those ligaments had broken. And so now her uterus was free swinging. And as it was free swinging, you develop what we call a strangulation injury. Anytime you have a torsion effect, a spinning effect, that's twisting tissue very, very dangerously. That's twisting nerves, that's twisting blood vessels. That can happen in the testicles of men, and it's an emergency surgery type of situation. So any sort of twisting movement, not good at all. So here again in this woman, lost one ligament, uterus was twisting. Well, something remarkable happened when they untwisted it and they restored the proper position of her uterus. Something amazing happened. Her Hunner's lesions went away completely. She is considered a complete and total cure. A complete and total cure. Gwen, hold that thought, honey. So the author of that case study actually went back into the literature and found lots of early discussion about IC and pelvic pain being the result of an injured ligament. So in this month, we have a fascinating new paper that is now going so far as to say that many of those patients with a neuromuscular origin for their symptoms, which is 85%, they believe that many of these patients actually have ligament injuries. So I want to read this quick paragraph to you because I can live with this. This makes sense to me. Okay. Scheffler in 21 reported a cystoscopy-validated cure of Hunner's lesions by repairing the uretosacral ligaments, right? That was that case study I just shared with you. And in 2022, another Dr. Goshen reported that patients without Hunner's lesions also had a complete cure when that ligament was repaired. Both of these authors hypothesized that ICBPS may be a phenotype of the integral theories. We call this posterior fornix syndrome. So posterior fornix syndrome, the fornix is the ligament that has broken. So this is the summary. This hypothesis explores whether visceral plexuses due to weakened ligaments serve as a primary source of pelvic pain impulses, leading to the development of an inflammatory condition such as interstitial cystitis. According to our hypothesis, and also I will say, it also shares similarities of patients who have vulvodynia and complex regional pain syndrome in their pelvis. So according to our hypothesis, such conditions involve axon reflexes, stimuli such as gravity applied to unsupported nerve branches within the visceral pelvic pain plexus that trigger centrally propagated impulses, which then progress to influence innervated tissues through cytokine release and nociceptor stimulation, perpetuating inflammatory processes at the end organs and pain perception. Okay. Basically, what that means is that without that proper support, gravity pulls on tissue. It pulls on nerves. And it essentially kind of damages those nerves. It creates a situation where neuroinflammation begins. And then as that neuroinflammation progresses, it then spreads to end organs like the bladder. So the key message is I see vulvodynia and other pain sites, even non-bacterial chronic prostatitis in men, different phenotypes of the chronic pelvic pain syndrome, which includes posterior fornix syndrome. If so, this hypothesis opens up several new research directions, and we would predict inflammatory findings in end organ pain sites like the bladder, like the vulva, like the prostate. So again, when 85% of patients struggling with bladder pain have a healthy, normal bladder, thus their symptoms are being driven by muscles and nerves, an issue with muscles and or nerves. A question then becomes, how do nerves get inflamed? And this is compelling. So we had another research study that came out in 2022 that followed 198 patients, IC patients, who also had prolapses because of a broken ligament. And when they fixed the ligament, the IC went away. It's almost 200 patients. Now you can see now why the diagnosis of IC is so difficult, because you have all the symptoms of infection, frequency, urgency, pressure, pain, but you take the antibiotic, they don't work. Eventually, over a period of weeks, months, or years, somebody says, hey, I think you've got this incurable disease called interstitial cystitis. Here's the diet. Here's some antidepressant. We'll see you in 6 months. And you do it. You want to get better. You do all that stuff. But you don't get better. Why? Because the bladder is being victimized by something else. That the end organ, the inflammation in the bladder may be caused by something else happening in the pelvis, whether it be tight pelvic floor muscles, whether it be a fibroid tumor pushing on your bladder, whether it be endometriosis on your bladder, whether it be a tailbone injury or a ligament injury. So this to me is fantastic. Our challenge is that urologists don't know to test for a ligament injury. And even most gynecologists wouldn't test for that. So you and I, we are the patient educators. We have got to turn on the incredible power of the IC patient community and say, hey, here's this new study which has found this weird ligament thing, and you've already told me I have a partial prolapse. Could that possibly be because this ligament is broken? And if it is, hey, let's fix this ligament, because when you fix the ligament, the symptoms go away. It's interesting. Listen, I got to go I drank a giant high protein smoothie right before I started this meeting. I try never to do that, but I was hungry. But I need to now run to the bathroom. So let's take a quick bathroom break, 30 seconds, a minute at the most. Anna says, this makes total sense to me. My pain is V-shaped along both groins, and the doctor says these are my ligaments that are inflamed. And the fact is that when I take an anti-inflammatory pill, the pain disappears. Just did a cystoscopy, and it was totally normal. Exactly. So Anna, that's so exciting for you. It's exciting for a couple of reasons. You got a perfectly healthy bladder. So doing bladder therapies makes kind of no sense. I mean, doing something that might calm some of the symptoms just to give you some comfort makes sense. But ultimately, in the end, your underlying problem is your ligaments, your very, very inflamed ligaments. So now I've got to figure out, why are these ligaments so inflamed? Is it because of how you walk? Is it, I think one of the great crimes against women is high heels. High heels does tremendous damage over time to the feet, the legs, the hips, and the pelvic floor. And as you know, I mean, when you're young and you want to look good, you're going to wear high heels. And once you hit your 30s, it's like, I don't really need to wear those high heels anymore. And once you're in your 50s, it's like, I'll wear tennis shoes. And that's what disappoints me about kind of a lot of the influencers we see, and even Princess Kate, who we saw yesterday for the first time while she's going through chemotherapy for the cancer that she has in her belly. Her heels are so high, and I really wish she'd wear lower ones so that other women and girls don't feel like they have to wear really, really high heels too. I don't think the woman looks better wearing high heels. The purpose of high heels is to get the butt pushed out, because high heels were invented by guys to make the female body more attractive. And I'm sorry, that really offends me. I don't need a guy telling me how my body should look. I don't need a guy physically changing my body to present my tush for his admiration. And that is essentially what high heels do. So, anyway, Carol says, have you heard of trigger point injections for nerve pain? I explained to the urologist I have nerve pain on my left side of my urethra. Pelvic floor therapy has helped a lot. Having a cystoscopy in August, and perhaps trigger point injections following the outcome. Well, the trigger point injections, just by the virtue of its name, trigger point means that they're going to inject into a tight muscle. That's different from a nerve block. A nerve block is where they're silencing the nerve with something like lidocaine or marcaine, something that will numb that nerve and turn that off. So if they're saying trigger point injections, then the target is a trigger point in muscle. And when we can get that trigger point to release, that will then restore blood supply and stop compression on those nerves, and that will help reduce nerve pain. Well, that's structurally different from a nerve block. Okay, I need to go to Gwen here. So Gwen here on YouTube says, they want to do a heart chemical test, but I'm afraid that the drug will cause vascular dilation in my bladder. I will say in 30 years, nobody's ever said that a heart test caused a bladder flare. And I've gone through heart tests myself, like recently, as I sadly inherited my dad's heart, which means that I throw arrhythmias and tachycardia all the time. And yet he lived to 100. I intend to live as long as I can. So I really, honestly, I wouldn't be worried about the heart test. I would just ask the doctor, have you ever had any instances where this has triggered severe bladder pain? I would be surprised if it did. The doctor says the drug dilates the vasculature in my body. I need to have oral surgery, but the heart test first. I do have severe pelvic floor inflamed bladder and MS. See, I guess what I'm not understanding here is, if it dilates the blood vessels, it increases blood supply. I don't see that harming the bladder. I see that potentially temporarily helping the bladder, but giving the bladder more blood supply. I could be wrong, but that's the way I interpret it. And of course, I'm not your doctor. I can't give you medical advice. My job is always to send you back to your doctor with a new set of questions. So I think you could ask your doctor what happens when you increase blood supply to the bladder. Is that something that we need to worry about? I can't see how it would be, but I'm not a doctor. You have to ask them. And Gwen said, the doctor said there were no bladder issues that he saw. Okay, that's good. That's very good. How are you doing with your pelvic floor physical therapy, hon? You have a severe pelvic floor and inflamed bladder. So how is physical therapy going for you? Is it going okay? And let's see if I missed anything here. All right, guys. So we go as long as you have questions. So if you have questions, please feel free to ask them. We did have a new stem cell study in IC, but it was in an animal model that showed success. But they were embryonically derived stem cells as compared to stem cells that come from fat. So I do not believe that we have human trials in the US using embryonically derived stem cells, which I would assume they would have gotten from placenta, maybe. Angel said I heard about that. Yeah. Yeah. And there was another one here. Wait, which computer is it on? Is it on this computer? The computer on my left is what I call my workhorse. It's where I do 90% of my work. The computer on my right is my streaming computer. But my workhorse is dying. It is definitely dying. It is old. So hold on a second. Let me... Okay, here it is. We have a new study. Now, this came from Iran. I don't necessarily hold researchers in Iran on IC at the same level that I would hold doctors from the United Kingdom or the United States. They tested medication called Montelukast, which is basically kind of an anti-allergy medication on children with bladder pain syndrome. And that was interesting because we rarely, if ever, see any studies on children with bladder pain syndrome. So this study tested Montelukast as compared to oxybutynin. Oxybutynin is a smooth muscle antispasmodic used for frequency urgency. We know it here as ditropan. And what was interesting about this study, and it was only a 2-week study, there was no significant difference in the two groups with respect to frequency and nighttime urination and urgency, but there was an improvement in bladder pain in patients and these young children who did Montelukast. Kind of what that says to me is maybe these kids were more allergy driven. Maybe. We have another study that was testing the equivalent of a rescue installation in interstitial cystitis. And the data is really quite good. Let's see where this study came from. India. Now, India had some outstanding researchers. So they treated 12 patients with weekly instills of alkalinized lidocaine, heparin, steroids, and bupivacaine. 82 and 90%, let's see, patients experienced 82 and 90% relief at the 3rd and 6th week of installation. After the completion of 6 cycles of therapy, patients experienced 68.7, 65.3% relief at the 3rd and 6th month follow-up, concluding and providing early and long-term relief from bladder pain. So in our U.S. national guidelines, they really are only using rescue installations for people who are bladder wall driven. So they're not suggested for patients with pelvic floor. They're not suggested for patients with Hunner's lesions. What they say is do an anesthetic cocktail first, do a rescue first. Let's see if it helps the patient. If it helps the patient, then you can do a course of rescue installation. So this was some good data here. It's a small study, but good. It's not surprising. We certainly do know that rescue installations can be quite beneficial. Let's see here. Let's see if I missed any. Anterior spinal artery syndrome. Why would that be in an IC study area? Nah, it's just categorized wrong. A new study on the role of lumbar disc herniation and how that can affect the bladder and cause pelvic pain. Oh, here's a study on hyperbaric oxygen. We know that hyperbaric oxygen therapy, that's where you go into a pressurized room. It's what they do for scuba divers who surface too quickly and get the bends. So it's about pushing oxygen into the body to help that body heal. So we already have research that shows that hyperbaric oxygen is good for Hunner's lesions. And so we have another study that says that hyperbaric oxygen therapy can be helpful. So lots and lots of good things happening, my friends. Lots of good things happening. Angel said, let's see. Gwen says, I start physical therapy Thursday. Insurance won't let you do both at the same time. Okay. Good luck, honey. Angel says, can you drink wine with the InterStim? Well, obviously not post-surgery because you're going to be using pain meds. You don't want to combine alcohol with pain meds. You got to be careful about, combining alcohol with any medication where there could be an increased risk of sedation. So antidepressants, things like that. So you definitely want to talk to your doctor or your pharmacist about that. Can you vape with the InterStim? It depends. I think vaping is really dangerous. It's as dangerous as smoking because any of those byproducts from vaping will end up in your urine, and they have the potential of irritating your bladder wall. And so, whether you're smoking or vaping, they both still lead to bladder wall irritation. And I was reading a study not too long ago, which actually found that vaping actually transmitted more dangerous chemicals into the bloodstream and into the bladder than even cigarette smoking, which doesn't make sense because the problem with cigarette smoking is the combustion and the burning, which creates toxic byproducts. But they were saying vaping does the same thing. So I'm not liking that for most IC patients. Sue said, have you heard any info on this pain nerve foam medication they're trialing? That they were just looking for more patients. And I've talked to some patients who've gone through the study and they thought it was quite easy to do. They were glad that they did it and it seemed to have helped them. And so, it's kind of like getting back to rectal pain. There's a product called Proctofoam. And so back in the day when I was having really bad hemorrhoid pain and rectal pain, what they first gave me were these steroid suppositories to slip into the rectum to just kind of calm everything down. It worked well. But then they suggested this product called Proctofoam, which was so much better and so much easier to do. And so I think that they're following along that line of research. I found Proctofoam to be incredibly soothing and comforting to my rectum when I was having moments when it was uncomfortable. Anna said, in the meantime, I've written to the lady you had given me the name of. She recommends a physiotherapist. Oh, good, Anna. Okay, so you wrote to Jane at the International Painful Bladder Association, and she gave you the name of somebody in Antwerp. Excellent. Oh, I'm so glad. I'm so glad, hon. We're actually having a meeting of the international groups. I just got a notice of it. And it's for the leaders of all the international groups. And I think it's on June 28th. Let's see. No, June 27th. The challenge is always timing because for me, it usually starts at 3 in the morning, 4 in the morning. And that doesn't work for me. Let's see what time it is this time. It's always tricky. Time zones are annoying for business meetings. Inevitably, things get messed up. Gwen, info on what? The international meeting is not for patients, it's for leaders. Oh, for Jane? You want the information for Jane? Sure. Her website, I think, is painful-bladder.org. I think that's what it is. She and I are the old, we're the grandmas of the IC movement. And she has a fabulous newsletter. Yeah, the International Painful Bladder Foundation. She does have a real nice science-based newsletter. It's very academic, though. But for anybody who wants to get into the science, go for it. Edna, I'm in the hospital due to uncontrollable bladder pain. It's been 3 days with bladder pain. Doctors are only injecting Dilaudid, and it's not working at all. One of the doctors said the pain is coming from a bad case of constipation. Edna, we started out our meeting talking about constipation. So when we're done, you'll be able to just restart the meeting and scroll. You know, I think I probably started talking about 20 minutes into the meeting. You can listen to the whole thing I said on constipation. It's very interesting that constipation triggers flares. And I think that there are a couple of reasons why. Number one, constipation is very uncomfortable when you stretch the rectum. That irritates all the nerves, and then all the other nerves become very, very irritated. So it can cause a lot of neuroinflammation. I think proximity matters also. If you have a lot of what we call rectal packing, where you've got, it's happened to all of us. This is just part of being a human. There are moments when stool collects in your rectum and it doesn't come out. It just kind of sits there, and then you get more and more and more until finally it's kind of packed in there and annoying as hell. And again, that stretches tissue, but it also has the potential of like literally physically pushing against other structures, whether it be your urethra or your bladder. I've had rectal packing. I think everybody's had. And there comes a moment in time where if you feel that beginning, you know, a glove and some KY, just flick that sucker out of there with your finger, can be incredibly pain reducing. I how old was I when I must have been in my early 40s when I was just really struggling badly with rectal pain. And I could feel it in there. And I was just like trying to go to sleep. And it's just like, oh, I can't go to sleep. It's so annoying. And you have this immediate perception of, I'm not sticking my finger up in my rectum. But desperation calls for desperate measures. And I just got out of bed and went, I'm just going to get rid of this thing. And literally 2 seconds later, it was gone and I could go to sleep. And so there are moments when using your finger to dislodge something stubborn that isn't coming out might be an option. Edna, did they give you anything? I hope that they gave you something, because the Dilaudid just promotes more constipation. Have they given you an enema? Okay, so the question is, are you still constipated, or are you having bowel movements now? Because they should not discharge you if you're impacted. So what they would normally do is maybe an enema to get things moving along. So Edna, what have they done to help get things move along? And then listen, when you get home, I mean, we all struggle with this. This is the price of being human, especially in modern times when our diets are so bad. You have to be very dedicated, consistent every day to make sure you're eating good fiber, drinking good water, 20 to 25 grams of fiber a day. And if your constipation is from medicine, there are you have to be even more aggressive than that. Sue earlier said that she uses magnesium, a little bit of magnesium glycinate to help with bowel movements. I take magnesium glycinate every night for muscle cramps and just to help keep things smooth. And so you have to have a plan for healthy bowel movements. Eating a salad is not high fiber. Eating a cup of split pea soup is extremely high fiber. So we want to try to improve your bowel health. And again, after we're done, so they gave you an enema and the enema did not work, but the Movid prep did. Okay. So the constipation has passed now, right? Do you feel empty now? Do you have any idea why you became so constipated? Are you on a medication that causes constipation? Gwen says, thanks, been there, done that. little finger action. You know, guys, listen. When you're young, you don't talk about this stuff. It's too embarrassing. But once you're in your 30s, 40s, 50s, it's like, we've all been there. I can still remember one of the funniest stories. One of the funniest stories a friend ever told me. So I used to work in San Francisco. And so it was a 2-hour drive there on the bus, 2-hour drive back, right? Not the time that you want to have any bowel issues when you're on a commuting bus with no bathroom. And my stomach was upset, so we went, and everybody went to a little restaurant, and I got wonton soup. Well, that wonton soup was so full of MSG, it was a colonoscopy prep. And 30 minutes later, we're back in the office. The cramping starts. I spend 4 hours running to the bathroom with diarrhea over and over. Finally, my boss was like, are you okay? And I'm like, it's just going through me. I was thinking about, how am I going to get home? I have to catch the bus at 5:15. How am I going to get home on a crowded bus with no bathroom? Oh, my Lord. One of the great challenges of life. And thankfully, by then, I was basically empty, but I wasn't sure. And so I used 3 menstrual pads. Just tried to create a pad just in case I started having an accident on the bus. Didn't have an accident. I was fine. But you have to plan. So anyway, my tennis partner at the time, she was driving through with her very, very proud husband. And, he didn't want to stop anywhere. He's like, we're going home. I don't want to stop. But he had the exact same thing happen in San Francisco. And unfortunately, he was so freaking stubborn. He actually had an accident in his car. And, listen, when you got to go, you got to go. Becky says, how many capsules of magnesium do I take at night? 1 or 2? I started off with half, but I do 1. And it's not a capsule. It's a big pill. And I have to cut it into sections to swallow it. It's very, very uncomfortable. The magnesium pills are really big and they scratch my throat going down. So, but I do 1. I don't do 2. It's about finding what works for you, honey. You could start with a half, do that for several days, see how you feel. If you're still having cramps or you're just not making progress, you could go up to 1. Just remember, more is not better. Becky said, you probably had a UTI after all that diarrhea. Well, so one of the things I had it before, floor muscles go, they just lay down tight. And you notice that literally you can't pee. And I've noticed that several times, that if I have an attack of diarrhea, I'm not going to be, I literally cannot pee. The muscles are too tight and I have to get up and walk around, and about 15, 20 minutes later, those muscles have relaxed enough so that I can now empty my bladder. Edna says, I don't feel any more movement. I feel I should use more because my doctor said that I'm incredibly filled with feces up to my neck. It's so much. Well, yeah, hon. I mean, I guess I would agree with you. If you're that full, I think I would want a few more. I would probably want a little bit more progress before you get home. Again, do you have any idea why you became so constipated? Were you just not eating right, or were you on medication that was making you more constipated, like a pain med? Becky said you probably had to eat. Yeah. Hi, Gay. Nice to see you, hun. Gwen says, which magnesium? Magnesium glycinate is the one that everybody talks about as being the most effective one. Magnesium glycinate. Glycinate. And by the way, that reminds me, I've got a couple. We added some new products to the IC Network shop. Let me show them to you. So I just reorganized the IC Network shop and rebuilt the front page. Natural Approach to Nutrition, which is my favorite company that we work with, they're so dynamic. They're so, they're always working to make things better. They're always working to make their products better. And they have started carrying a line of high absorption products. So we've got high absorption quercetin. So quercetin acts as a mast cell inhibitor. So for patients who are struggling with allergies, this need an antihistaminic effect, this high absorption quercetin might be something that you could try. And it does have a buffered vitamin C. So it has very low acid vitamin C in it that should not irritate your bladder, unlike other quercetin products on the market, which do contain very acidic vitamin C. The second thing we have is high absorption curcumin to try to combat inflammation. So this is very exciting because this is focusing on reducing inflammation and neuroinflammation throughout the body. I'm sure I'm missing part of its method of action, but it has curcumin, it has quercetin, turmeric, bromelain, and ginger extract. Supports joint and muscular health, supports cognitive health, and supports cardiovascular health. I gotta say, listen, my cognitive functionality is not quite on par. It really changed. It really changed after I got COVID in January. Like I'm just like not as, and we know that COVID can get into the brain and that it can, add like 10 years of aging to the brain. And I definitely feel that. It's quite frustrating. And we have high absorption R-lipoic acid for nerve discomfort. So if you want to learn more about these products, you can go over to icnsales.com, and they're right on the front. I know I'm getting the curcumin wrong, so hold on a sec. Let me. My microphone stand broke, so I've got my microphone kind of jimmied right here, which is why I have to be careful with how I'm moving. Let me just read you what he says about curcumin, because I know I'm not getting that right. Okay. It's not how much you take, it's how you take it. Multiple studies have demonstrated that consuming high absorption curcumin can deliver several tangible health benefits to the body. Study findings support improved oxidative stress, flexibility for minor aches and muscle soreness, and superior response in joints, muscles, GI tract, liver, brain, eyes, and nerves. So anyway, and then we also have, oops. Hey, this is our waffle cushion. If you have pain when you sit down in your glutes, as I do, Sitting on this waffle cushion is wonderful. And then the other product that we have brought on is Uroprostus for men. Fantastic label. This is a prostate formula that's already doing very, very well for the company. So for any men out there who might be struggling with kind of more prostate-centric pain, you could always try Uroprostus. Who knows? The good news is that we just have a lot of options now. You know, that generally the guidelines want you to try the easiest stuff with the lowest side effect profiles before you go to medications and treatments that have high risk. And so our IC guidelines have long said, begin with the easy stuff first, like the OTC supplements, before you go into medications that can, for example, cause severe constipation, like amitriptyline, or cognitive decline, like ditropan or amitriptyline. Or, you know, and of course, Elmeron is associated with retinal disease. I was talking to a patient just the other day who had no idea that she had taken Elmeron for 5 years and was having eye issues. She had no idea of the research and the class action lawsuits and the new black box label. Renee says, I've not had the diarrhea experience on a bus, but on a bus line in Atlanta years back, it was a nightmare. Only once. Jill, that hilarious bus story. Glad you're laughing. Well, did you hear, like, earlier this year, like a couple months ago, somebody on a plane had explosive diarrhea all the way up the aisle in the middle of the plane flight, and like it sprayed people. I think they had to do an emergency landing. Can you imagine the nightmare of that? Like, I have certain rules, and one of my rules is I'm really not going to get on a plane if I'm feeling poorly. I'm just not going to do it. Anne says, what is better to use, topical estrogen or topical DHEA? I think, Anne, it's really a question of trying both and seeing which one works better for you. Renee says, you're not alone. Menopause wrecked me. Yeah. I mean, honestly, I do feel like I've aged 10 years in the last 2 years. Carolyn said, same here since I had COVID. Yeah. I've had COVID twice, but the first time was fine. The second time in January, but that was also at the 6-month mark of severe grief. But I definitely feel like I'm forgetting more, but not really. I mean, I have to think longer to come up with a word, and simple words I should know. You know, like as I was preparing for this meeting, I was trying to remember, was it a ligament or a tendon? You know, it's like, it's a ligament, Jill, but I actually Googled it just to make sure. Edna says, I've always suffered with constipation, now more than ever due to pain meds. So Edna, there is a new medication created specifically for patients with opioid-induced constipation. Let's see what the name of it is. Here, hold on. I mean, you have to be much more diligent because you're on meds. So Movantik or Relistor or Amitiza or Simproic. Those are meds that can help with opioid-induced constipation. But you can also use a number of other products like Docusate. Docusate is a stool softener, and that increases the amount of water in your colon and will help stools pass more easily. You could potentially use a stimulant like, okay, speaking of cognitive, what is the stimulant herbal tea? Oh, come on. What is it? Senna. senna. So the stimulants work by triggering bowel spasms. But what happens if you use them every day, your body becomes dependent on them. And so you do not want to use those every day. Or you can use something called an osmotic, which is basically magnesium or polyethylene glycol Miralax, which also helps fluid move through the colon, which then helps stool move through the colon. Also, even something as simple as mineral oil that you can use in an oral or even in a rectal form. And of course, enemas or suppositories. Let me give you a link to this article so that you can read this link, hon. Edna says, the nurse gave me Toradol, gabapentin, and oxybutynin for pain an hour ago, but unfortunately it's not working. I wonder if it was because I was eating a magic cup of vanilla ice cream. I don't think so, hon. They just take time. You know, so the Toradol, I would hope, would turn off some of that pain within 30 minutes. The gabapentin acts to calm nerves down over time, so it might chill it a little bit. The oxybutynin is a smooth muscle relaxant that helps calm spasms in the bladder. That should turn off bladder spasms in 20 minutes. I don't think the vanilla ice cream is playing any role in this. You know, it's really hard right now because so many doctors are just very, very uncomfortable prescribing strong pain meds. And you've been in the hospital for 3 days with severe bladder pain. They know why. You're severely constipated. So once that constipation is resolved, things should start to get better. And said, okay, hold on a sec. And you guys remember, my screen pops up and down all the time. Edna says, I was prescribed Elmeron a month ago, but read that it was bad for your eyesight. Yeah, it's a black box warning, honey. It's a black box warning. We've got hundreds and hundreds of lawsuits of patients with badly damaged eyes. Some are now legally blind from that medication. So Elmeron acts as a coating for the bladder. It's like a chemical Band-Aid. You know, but the thing you have to ask yourself is, hey, if I swallowed a Band-Aid, would it come out the other end a Band-Aid? And the answer, of course, is no, because we have digestion. And digestion breaks down over 90% of that Elmeron, rendering it chemically neutral, useless. So, you know, when we're thinking about IC and pelvic pain and bladder pain, we don't want to just chase the symptoms. We want to try to find underlying cause. We want to try to fix the underlying cause. So this is why we do phenotyping. We want to try to figure out what group you're in so that we can do the right treatment for your group. So the most common cause of severe bladder pain is a Hunner's lesion, a wound in your bladder. And so if you're struggling with really, really severe bladder pain, combined with blood in your urine, you could potentially say, don't you want to look at my bladder and see if there's anything funky going on, like a bladder stone? At some point in time, looking in that bladder, it might be very, very important. And my personal philosophy is, if I'm in a lot of pain, I don't want people to guess. I want you to look at the damn thing and tell me what's wrong with it. And so doing a quick cystoscopy to look in the bladder to see if there's anything funky going on there is not a bad idea. Or one of the reasons why your bladder could be so very irritated is because it's being chemically injured. If you drink a lot of coffee or diet soda, things like that, that causes a chemical injury to the bladder. Or we're going to look for estrogen levels, estrogen atrophy. As we get older and we start losing estrogen, that directly affects our bladder, and our bladder becomes more vulnerable. The bladder protects itself with a nice thick coating of mucus. So your bladder is like your mouth. It's a hollow organ and it's wet on the inside. And that wetness, that mucus, acts as a barrier. It's protective. It protects skin. So the more wet it is, the better you are off. Unfortunately, it is estrogen dependent. So when you're young and you have lots of estrogen, you got lots of mucus, and you're good. But if you're on birth control, if you're on Lupron, if you've had a hysterectomy that's taken your ovaries, or you're just older, you don't have the estrogen anymore, which means you don't have the mucus anymore. You don't have as much mucus. You might have had this much mucus before, now you have this much mucus. I mean, obviously that's graduated. That would be in millimeters, or even even smaller than that. But if you're at that age, and if you have a dry vulva, you have a dry vagina, then you also have a dry urethra and a dry bladder. And so therapeutically, the correct treatment for that is going to be some topical estrogen to give that skin estrogen so it'll plump up and produce mucus again. And then you could do rescue installations to calm your bladder down. Or you could do the over-the-counter version of a coating, which would be bladder rest or bladder builder. These are chondroitin-based supplements that act to coat the bladder. So if you've never heard of the concept of phenotyping, you need to come on over to our website, icnetwork.org, and read that section. And if you want to talk about it, feel free to call. Be happy to talk to you. But again, I just need to say to everybody, I'm not going to be here this summer. Starting in July, I'm out for 2 months because I'm having a double mastectomy for breast cancer. So get me while you can. Get me while you can, because I simply will not be able to answer the phone. So it'll be the second time in history that I will shut down my office for 6 weeks to 2 months. Wish me luck. Wish me luck that the biopsy of my lymph nodes shows the cancer has not spread. Hope right now it's ductal carcinoma in situ stage 0. They don't believe that it's spread, but they have to check the lymph node anyway. And I'm going to have I'm going to have 16-inch incision, total of 17-inch of incision across my chest, because I'm not doing reconstruction. I'm just going flat. I'm letting the girls go. The girls have annoyed me for decades. I will not have to be locked and loaded in sports bras as I get older. That appeals to me. And actually, I had a patient call me who had gone through the same thing, and she had reconstruction and they gave her implants. And she had the implants taken out. She said, Jill, I feel so much better just flat. And she said, I feel younger. And I'm like, she said, you're going to love it. You're going to feel so much better. And it was exactly what I needed to hear. Becky says, will saffron irritate the bladder? I don't think so. But it's never been studied in a research study. It's one of those things where you just have to try it. And you say you saw Body of Ollie's Happy Gummies, but they have citrus in them too. Just curious. Well, remember, it's the amount of acid that matters. If the citrus is just the very, very last ingredient, then they're probably just using a little bit of citric acid to pH balance the formula so that it's shelf stable. In contrast to something where citric acid is the second ingredient, like in soda, or the third ingredient, there's a lot more acid when the citric acid is in the first part of the ingredient list rather than the last part. So the odds of that gummy bothering your bladder, I don't know. Depends upon where the citric acid is in the ingredients. Edna says, I know their plan is to discharge me tomorrow with no plan to follow. I came here by ambulance, and they usually give me an injection for pain and then send me home. Oh, honey. So girl, listen, you need to become an IC warrior here. You need to take your power back, because there's a lot you can do at home that will move you in a better direction. And part of that is going to be diving into learning how to control constipation and making sure that you adjust your diet so it's high in fiber, and also asking, there are some people who have used pain meds for years and years and years, and that's all they do for their pelvic pain. And it's like, wait, that's never going to fix anything. That's just going to put you on pain meds for the rest of your life. We don't want to do that. We want you to be functional, and we want you not to be constipated. And so what we have to do is go, okay, what's causing the pain? What is causing this pain? Is it tight muscles? Is it estrogen atrophy? Is it a Hunner's lesion, etc.? That when we can identify the underlying cause, we can treat the underlying cause so that your pain will go away and you won't need the pain med. Pelvic floor physical therapy outperforms every other IC treatment 2 to 3 to 1. 2 or 3 to 1, depending upon the study. The single most effective treatment out there is pelvic floor physical therapy, and that has been confirmed in multiple large studies done by the U.S. National Institutes of Health. So I want to know, are your muscles tight? You can always tell the health of your muscles based upon how you pee. Listen, if you sit or you standing in front of the toilet and you can let go and pee like a horse, you're good. But if your flow is diminished, if your flow is stopping and starting like mine was in there, if you hesitate to start, that you have to wait 5, 10, 15, 20 seconds to relax enough to release urine, you got pelvic floor dysfunction. Physical therapy can cure that. It can heal that completely. So this whole perception that IC is a bladder disease is wrong, and that's what our national guidelines now say. The national guidelines from the American Urology specifically say that no bladder disease is found in the vast majority of patients with IC. That IC is, in fact, neuromuscular for the great majority of us. So Edna says flow is diminished. So what that tells me then, Edna, is that one of the reasons why you might be struggling with constipation is that your muscles are tight and they're not easily relaxing enough to let you have a bowel movement. See, the pelvic floor muscles are skeletal muscles. These are muscles which help us move our body. They open and close your legs. They do all sorts of things related to movement. But what makes the pelvic floor muscles very unique is that they also control 3 major bodily functions: peeing, pooping, and sex. Why? Because they have holes in them. There's a hole in them for the urethra, there's a hole in them for the vagina, and there's a hole in them for rectum. So you basically have muscle wrapping around your urethra, wrapping around your vagina, and wrapping around your rectum. These are called levator muscles. And if these muscles are tight, what do? They squeeze down on the urethra, they squeeze down on the vagina, and they squeeze down on the rectum. So constipation can be caused by very tight pelvic floor muscles. So what our guidelines now say as of last year, or either early last year or late 2022, is that the very first appointment in a patient who's suspected of having IC, that a pelvic floor assessment should be done. And if the pelvic floor muscles are tight, tender, and dysfunctional, that patient should be immediately referred to a physical therapist. We're long past the days of saying, take some Elmeron, here's the diet, and go home. We don't do that anymore. That's what they did 20 years ago, 15 years ago, 10 years ago. Now we very clearly understand the role of the pelvic floor muscles in causing all of this. And we also have the research that proves that physical therapy is far superior to any bladder treatment out there. And when that study came out in 2008 or 2011, one of those years, that's the moment that the IC world was put on its head, because up to that point, everybody went, but this is a bladder disease. And then we have a research done by the U.S. National Institutes of Health, a large multi-center study, which found that pelvic floor physical therapy outperformed Elmeron 2-1. And the entire world went, wait, how is this even possible? IC is a bladder disease. And they went, uh-oh, maybe it's not a bladder disease in some patients. Maybe it is a physical injury. And now, so that's when the doctors slowly started, about 10 years ago, slowly started doing more pelvic floor assessments. Then slowly more and more physical therapists receive training in pelvic floor work, because it's not Kegels. We don't do a Kegel. Kegels will make it worse. This is about relaxing tight muscles. And now today, in the last year, the new estimate, the new number they're using is that 85% of IC patients are nerve or muscle driven. And that's one reason why we have a new letter to the editor in the Journal of Urology saying it's time to stop using interstitial cystitis so broadly. In Europe, interstitial cystitis is a diagnosis given to patients with Hunner's lesions. People without Hunner's lesions, the vast majority of patients, over 90% of patients, instead are diagnosed with bladder pain syndrome or pelvic pain syndrome. And here in the United States, we did not jump on that bandwagon because we have a Social Security ruling on interstitial cystitis. And the concern was, if we stopped using that name, people would lose their disability insurance if they're qualified for it. So in the United States, we went, okay, we're going to say IC-BPS, IC/BPS for bladder pain syndrome. But get ready, IC is going to go away. Sooner rather than later now, IC is going to go away. It is going to be called bladder pain syndrome. You're going to see me talking a lot more about bladder pain syndrome than IC in my videos. And I hope you've watched our masterclass, our free masterclass on IC, which is now available on this YouTube channel, as well as on our website. I've got a lot of videos up there right now. I've got a lot more videos going up there, but I've also just started doing a breast cancer daily vlog, so that's going up there too. People are like, why do you want to talk about your breast cancer? And it's like, it's therapy. I have to talk about it. And I think we need to talk about it. I think we all have to be supporting each other a lot more. Okay, Edna says, I need a physical therapist in Burke, Virginia. Okay, let me look. Whoops, hold on a second. So I have a lot of videos in the process of being uploaded right now. Okay, so Burke, VA. Let me see. So what's coming up, there's a lot in your general area, hun. Man, there's probably 30 or 40. I kind of need to know a little bit more about where you are, because it basically pulled up Eastern Virginia. So, for example, I mean, I'm looking at least 30 or 40 in that general area, but in Franconia, there's a pelvic certified one. In Alexandria West, there's a pelvic certified one. In Washington, D.C., there are a couple. In McLean, Virginia, there are a couple. In Vienna, Virginia, there's one. And there's two at VHC Health for the Virginia Hospital Center. So I would encourage you to go. Okay, well, here, hold on. Let me put in your zip code. And Carolyn, you hold that. Ravonda, give me a moment and I will answer that question. Okay, so 22015. Let's see. Ah, there you are. Okay, so you can go north, east, or south and find them. There's a couple up in Fairfax, but that looks like it might be 30 minutes away for you. There's one down in Newington Forest, and then just to the west of you in Springfield. So go to pelvicrehab.com. That's short for rehabilitation. There you go, pelvicrehab.com. Okay, and so hold on one sec here. Ravonda asked about pre-leaf. One of the ingredients is calcium glycerophosphate. Could this possibly contribute to kidney stones? Yeah, if you struggle with calcium-based kidney stones, they generally don't want you taking calcium supplements or cutting way back. Pre-leaf, I will tell you, is the oldest, most cherished, most beloved supplement used. It's been available for well over 30 years. The side effect profile is very, very, very low. In fact, I can't even remember a time somebody called and said they had a side effect. I mean, it's been at least 20 years. So pre-leaf is like Tums. It just reduces acid in your stomach. But if you do a lot of it, that calcium has to go somewhere. And some people eat pre-leaf like candy, and that's where you just don't want to do that. You don't just take it all day, every day. You only take it right before a meal, and only if that meal is going to have some acid in it. All right, Carolyn needs somebody in. And for anybody out there, if you just can't search the internet easily, just call me this week and I'll do it for you and I'll give you a list, okay? So let's see. Let's go to Pennsylvania here for a moment. It does not want to cooperate. Okay. All right. So for Fairfield, Pennsylvania, there's one in Waynesboro. There's one in Chambersburg. There's one in Gettysburg, and there are 3 down south. The nearest certified physical therapist who's had all the training is in Frederick. So again, go to pelvicrehab.com and you can get their names, or I can do that for you and give you their names over the phone. Edna says, my husband, thank you. You're very welcome, husband. Thank you for being so supportive. Siv says, what about Botox treatment in the bladder? So Botox, in fact, I just filmed a video on Botox as part of our master class. And again, the master class is completely free. So you can go and watch these videos to talk about all the treatments, diagnosis, all that sort of stuff. So Botox is only considered if a patient has not responded to other therapy. Botox can be injected in two places. It can be injected in the bladder wall directly, or it can be injected in a tight pelvic floor muscle to try to get that muscle to relax and release. Botox acts by turning nerves off. And so in the bladder, the goal here is to try to silence the nerves that are driving a lot of extra frequency, urgency, and or pain. But the problem, the risk of Botox in the bladder is that they can accidentally silence the nerve that helps you pee, leaving you unable to pee for a couple of weeks or a couple of months until the Botox wears off. So, and then we just had, as part of the IC class that was taught at AUA in early May, the Dr. Henry Lai said that he only uses Botox in the trigone area of the bladder, not in the rest of the bladder, and that dramatically reduces the risk of needing to self-catheterize, that risk of urinary retention. So Siv, again, it's all about trying to understand what your phenotype is first, because we want to treat based upon the phenotype. You know, in Dr. Lai's presentation, the first slide he had was somebody who was blindfolded throwing a dart at a dartboard. It's like, and you're just going to hope you hit the dartboard, right? And he said that's how a doctor feels treating IC. It's like you're blindly throwing treatments. You never know if they're going to hit. That was the norm of IC for 50 years until we started phenotyping, because the phenotyping now gives us very clear clues on what treatment could work for you. We don't want you to be on treatments that are expensive and costly with side effects if it doesn't have a chance to really help you. So we want to phenotype before doing something like Botox. I have a whole video. I've got bunches of videos on phenotyping on the IC Network website. I use the phenotyping system created by Dr. Christopher Payne, who ran the IC research program at Stanford University. He believes that there are 5 core variants. The National Institutes of Health combines 2 of his, so they believe that there are 4. But Dr. Curtis Nickel up in Canada believes that there are 9 distinct groups, each with their own treatments. And so I cover all of those on the IC Network website. And I think for you, this is about you saving money and time. You know, I had one elderly lady call me, and she had run out of money. She had invested her entire life savings on Elmeron. And back then, you know, it was probably $30,000 or $40,000 at the time. She was done. She had no money left. And she called and said, what do I do? And I said to her, I said, did it help you? And she had said, never. And then I said, well, then why did you keep taking it if it didn't help you? And she very correctly said, because they had nothing else for me. Okay. We don't do that anymore. And our guidelines say, if you're not responding to a therapy, stop it. If you're not responding to treatment, take a step back, revisit the diagnosis. Let's see what we missed. And in those older days, in my days, what they missed was pelvic floor injury. Cindy said, my sister's physical therapist sent her home with exercise for pelvic floor tension. Is this as effective? No. Hands-on physical therapy, a finger in the vagina, is the most effective, and that's proven with research. Let me get my model here. Hold on a sec. All right. So let's see here. Oops. My microphone is precariously balanced right now. Okay. So let me show you this so that you have a really clear understanding. So hello, pelvis. Let us meet the pelvis, shall we? So this is the front side of your pelvis. Here's your pubic bone. And you see your pubic bone is actually two bones that meet in the middle. We call this the pubic symphysis. Because the pelvis is actually a mirror. You've got one set of bones on this side, and you've got a matching set of bones on this side, your hip bones. Okay. So from the front, this is your pelvis. Now let's look at the back. It's always hard, it's always hard to get camera right. So let's look at the pelvis from the back. So now, here's your spinal cord. Here's your sacrum. Here's your hip bones. And if we tilt a little further, there's your tailbone. Look at everything that is attached to the tailbone. The tailbone truly is the center of the pelvis. You've got muscles that go around to the left, and you've got muscles that go around to the right. Okay, and remember I was talking about tailbone position. You can see that the tailbone goes down and under. So if you've broken your tailbone, and your tailbone, instead of curling under, now curves out, what's that going to do to all the muscles here? That's going to really mess up your pelvic floor muscles that are attaching to your tailbone. Okay, now let's look at it from the top down. So on the inside, now we have our first glance of the pelvic floor. The muscles lay at the base of the pelvic cavity. They're on the inside of the bone. So you can't really reach the muscles from the outside. The best way to reach the muscles is with a finger in your vajayjay or your rectum. And so pelvic floor, myofascial pelvic floor therapy, the most effective form is a finger in the vagina, working these muscles, massaging these muscles, following the length of the muscle. You see this? On both sides. Now, what they can do, I just be real honest. If there's a physical therapist who doesn't want to do internal work, that tells me they're not trained. Because the internal work, as you can see, as I do this on this model, is just so effective at reaching these muscles and touching these muscles. A healthy muscle feels like a raw chicken breast. It's soft, but it has substance. A tight muscle feels like painful beef jerky. It's stiff. It's raised up off of the bone. It's not pretty. Okay. So after you've done physical therapy for a period of time, you can then get a wand yourself. And the goal here is for you to learn when your muscles are starting to get tight so that you can go in and massage it early so it doesn't build over time and create a crisis. And so, again, the advantage of doing a wand is you can see that the wand will reach these muscles too. See that? It's, it's just so hard. I have to look at it. I can't look at the screen because it's mirrored and backwards. See, so I'm going along the length of the muscle here, and I'm going along the length of the muscle here. Sometimes they will have you go crossways. It's like strumming a guitar string. Sometimes they will have you do that. Sometimes if you find a trigger point, they'll have you push on that trigger point for 10 or 15 seconds to try to get that muscle to relief. So it's really about getting to the muscle directly, and exercises are not going to, I mean, they might help a little bit. Now listen, there are some people whose muscles are so tight they can't do that right away. I mean, they're locked down in tension. They've been locked down into tension for years. They might not be able to get a finger in the vagina to start with. So for that patient, they will start externally and try to relax the muscles in the glutes and the legs and the lower back, working from the outside inward to just slowly bring muscle tension down so that they can eventually get into the vagina and work with those muscles. The other barrier really is for people who have been sexually abused. If you've been sexually abused, the thought of anybody putting their finger in your vajayjay or rectum is like, no, absolutely not. And that's completely understandable. And there's no shame attached to that. If you would find internal massage traumatic, you have to tell the physical therapist that. And in that case, the physical therapist will certainly start with things like stretching. And hopefully over time, you will build confidence. She will build confidence with you. You will build confidence with her so that eventually they might be able to try a little bit of internal work, because the internal work is stunningly effective. It's so effective. And again, we have the research that proves that it was effective. Edna says, I was injected with Botox 2 years ago and it gave me an infection. I will try again to find out if it was just a bad day and if the actual treatment can help me. Well, again, Edna, it depends upon your phenotype. When you get home from the hospital, why don't you call me this week? And let's see if we can narrow down what your phenotype might be, hon. And I want to know what's going on with your muscles down there. Have you had a pelvic floor assessment? If you haven't, that would be one thing I would ask them to order quickly. All right, somebody said something about Anne said her friend's implants got infected, so you're doing the right thing. Yeah, I actually had another doctor that I was talking to, one of my friends who's one of the top pelvic pain specialists, and I had to bow out of doing a meeting yesterday with her. I just couldn't do it. And yeah, I just couldn't prepare a presentation given the fact that I cry every day at some point in time. And we were talking about my options, and she said, putting something foreign in your body might not be a good idea right now. She said she really agreed with my decision just to kind of go flat and let everything heal. And then, in a year or two, if I decide I want implants, I can do that. I don't think I will. I like the idea of just that's like my goal for the rest of my life is to simplify. I just want to simplify everything. I want to eat good food. I want to get rid of junk food. I want to get rid of junk in my house. I want to live a light, lean life, physically, mentally, emotionally, environmentally, As they say, it's just junk. Oh, I got to tell you something. You guys want to hear something hysterical? So I live in fire country. And in fact, we're going into a big fire alert tomorrow. It's really windy right now and it's high fire season. Whoops. And we've already had a couple of scary fires. So Anyway, that's just a whole nother level of stress. Let's just hope I don't have to evacuate the day of my surgery. That would be really, really bad. So a lot of us have lost our home insurance. I lost my home insurance last month. State Farm is not a good neighbor. State Farm can kiss my ass. We had never filed a claim with State Farm. State Farm had insured this home for over 40 years, and they canceled us. So right now, virtually no insurance carriers are writing policies here in California because the state of California won't let them raise their prices. I'm willing to pay more. I mean, I was paying $2,200. If I have to pay $3,500, I'll do it. Our only option is the California Fair Plan. And the California Fair Plan basically triples or quadruples. More money for less coverage. And they want a roof less than 25 years old. So a lot of people are getting their roofs replaced right now. Now, my roof is perfect. There's nothing wrong with my roof. It looks great. And it's not wood shingles. It's non-flammable tar shingles. But I couldn't remember when it was replaced. I just couldn't remember. I was thinking 30 years ago. Okay. So this is big because if we were to burn down, they will not cover the replacement of an old roof or the replacement of an old furnace or the replacement of old plumbing or the replacement of old wiring. Like literally, that's the plan. And so my sister and my brother-in-law came down and we were just looking everywhere for construction records. And we couldn't find them because my parents were not organized at all. I mean, it took us a month just to put everything in a pile and create, files. So we're going through stuff. We just can't find it. And then, but I keep have this niggling feeling. I'm like, we're missing something. We're missing something. So I go out in my garage and I'm just standing there looking in my garage going, there's something out here. Right in front of me, covered by a box of toilet paper that my dad bought. We've got this giant box of toilet paper. Remember when we couldn't get toilet paper during COVID? It's just sitting there. There's a file. There's a bunch of files. There's, a two drawer file cabinet. Actually, a 4-drawer. There was 2 of them. Oh my God. What's in there? My parents had their bank statements going back 40 years. All of their bank statements in envelopes. So we opened up the bank statement and we found it. We found the checks that paid for the roof 24 years ago. So we made it by it. We literally made it by 4 months, like 24 and a half years ago. The roof was built. I could not believe it. I was like, oh my God, this is incredible. Otherwise, I'd have to find $25,000 to replace the roof. And I could not replace a freaking roof in July, recovering from surgery. It's too dirty. So this was just massive. I was so happy last night. I mean, the roof's probably going to have to be replaced within 2 years, but at least at this point, I don't have to worry about replacing the roof while having a double mastectomy. So thank you for my parents who were terribly unorganized and just dumped all their bank statements in a box. All right. Angel says, that's what I want, a simple life like before. Yeah, I just want to let things go. Focus on the important things: managing stress, eating good food, living a simple life. Get rid of junk, get rid of dust. Like, this is my style. I mean, just like white shelves and not a lot of stuff on them. But it's hard to let go of things that are precious, that your parents found precious, that you don't find precious. What do you do? And that's where the psychic Tyler Henry gave a great thing about, it's just stuff. Now, whether you believe in psychics or not, that's up to you. I believe in spirit, so I do believe that there are people who can listen to spirit. And he was talking about the first time he saw a spirit, and it was his grandmother right before she died. And the message that she gave him was, and it was a younger version of his grandma, was, "It's just stuff, Tyler. It's just stuff." And she was holding a necklace in her hand. And then the next phone call literally was the dad saying grandma had died. So he really had a premonition, or her spirit visited him, that grandma had died. Well, a week later, they went to her house and they found it empty. That another family member came in and cleaned it out, nothing of value. It was empty. They were stunned. I mean, basically, a family member stole everything. And 10-year-old Tyler's going, why is she saying it's just stuff? It's just stuff. But that was why. The message was, don't worry about all that. It's just stuff. It's not important. Get all upset about it. And then, as they were walking through the house, they looked under her bed where the other family member forgot to do it, and they found a little box. And in the box was the necklace that she had her hand around. And he had that box at the show we went to a couple weeks ago. And that's the one thing he kept, was the necklace that she was holding on to. And I have turned to that message, it's just stuff, going through everything. Because I don't have to keep everything. And we all have friends who have inherited from their parents, and their small houses are overwhelmingly filled with furniture. It's like, it's just stuff. You can let it go. Anyway, Edna says, okay, and so we did Edna here. I get comfort from that. All right, any other questions? We've been going for 2 hours and 12 minutes. You can, because I'm not going to be here in a couple weeks. Don't take that the wrong way. I fully intend to be back. I'm not dying. I'm just having surgery. But I do have to take a break. And for those of you who have come in, we have our latest magazine, The Icy Optimist. If you're a member, it's already on your member page. Go ahead and download it. If you get it by mail, it's already on the mail. It's already in the mail to you. And yes, I did just see the typo on the front page. It's kind of a miracle I got that out, because I got that out the week after I was told that I had breast cancer. And honestly, I was a wreck. So I'm going to give myself some grace and not worry about a typo. All right. Last call for questions. Last call for questions. Wish us luck tomorrow with the big fire alert. You never know these days. Angel said, I'm getting ready for surgery in the morning. Thank you. Love you. Honey, good luck with your surgery. Love you right back. Big giant hug. This is a hug. And for BTS lovers, Jen is back. Hey, listen, I'm a K-pop fan. I love BTS. I love the boys. RM, B, Suga, JK, J-Hope. Jimin, and Jin. And they all had to go do mandatory service in the Korean Army. And Jin was the first to go in, and he just got out this week, and it was so exciting. I just love those boys. I love those boys because they're kind and they're sweet and they're funny. You know, the Korean artists are not like American artists where they're dropping F-bombs all the time and they're aggressive. The Koreans are, they can be aggressive, but there's the messages that they give in their music are a lot like the messages from the 60s and 70s. Like there's real stories and there's real messages of being kind to each other and loving yourself and self-esteem and all that sort of stuff. Um, so I love the BTS boys, and they're the hardest working band ever, I think, in history. Their performances, you can see their performances live on Disney, and they're just awesome. And my favorite is V. I love V. For any other Botox people, I mean, for any other BTS people out there, I think V is the most handsome man in the world. He's just so adorable, but incredibly handsome. All right. Last call for questions. Last call for questions. Otherwise, go call your dads, give them hugs, drop by, bring cookies, bring beer, bring whatever it is that they love. Tell them that you love them, even if they're not the best dads, even if they've made mistakes. We all make mistakes. Listen, take it from somebody who just lost her dad. They're precious. These moments are precious right now. If you can, call them and spend time with them and tell them that you love them. Edna says, tomorrow I'm seeing all 3 doctors before I leave the hospital. What test should I ask them to order? Well, I mean, Edna, it's hard right now because you're still massively constipated. So it's hard to know what that's done with respect to inflammation. I think all the nerves in your pelvis are probably on a hair trigger right now. They're probably causing a lot of pelvic pain right now. And once you're not constipated anymore, give it a week or 2 and things could calm down tremendously and you could feel a lot better. But if you're having a lot of pain on bladder fill, like the fuller your bladder gets, the worse it feels, and you're struggling with a tremendous food sensitivity, I would ask them to look in your bladder. I would ask for a cystoscopy. Just for a quick looky-loo. It's a very quick 5-minute test. They just numb your urethra, stick a cystoscope in, take a quick look around, make sure there's nothing else happening in your bladder like a bladder stone or something like that, or a Hunner's lesion. Because if you have Hunner's lesions, the lesion should be treated at that time. The number 1 cause of long-term chronic pain, especially intense pain in the IC patient population, is an untreated Hunner's lesion. I mean, lesions are big bloody wounds on the bladder and they hurt like hell. We want to cauterize those lesions, seal those lesions so that they're not exposed to urine and so sensitive. Edna says cystoscopy. Yeah, that's just looking in your bladder with a cystoscope. Come on over to the IC Network website, icnetwork.org, and look at the diagnosis section. We talk about cystoscopies. Very easy to do. A urologist on staff should be able to do it. And it's quick and easy. The question is can they get time in the procedure room to do it? But, you know, again, my philosophy is if I'm in pain, I don't want anybody to guess. I want facts. I want you to look at it. So if my doctor wanted to do a cystoscopy right now, I would say sure. And so Edna says, my biggest problem is right after I eat, excruciating pain. So that tells me that your bladder wall is not doing well. So we need to know what's going on with your bladder wall. So letting them look at it to see if you have Hunner's lesions, perfectly viable. I would also want them to do a very extensive UTI screen. I would want them to look for bacteria, but I would also want them to look for fungus because we've now correlated fungal infections with bladder pain, candida, and candida is common in hospital settings, nosocomial infection. So Kayleen is at the doctor she's at the ER right now. They're setting up for an x-ray. Good luck, honey. Good luck. You can do this. You can do this. So again, Edna, looking in your bladder, ordering a comprehensive urine screen, including for fungus, that would be another thing that I would want to do. Other than that, I think the most important question is, why am I struggling so badly with constipation? Is it from the pain medicine, or is it because I have tight pelvic floor muscles? I think you can have a pelvic floor assessment. I think having a follow-up with a physical therapist makes perfect sense. Let's see if you've got anything going on with your muscles. And a follow-up with the urologist if you've got Hunner's lesions. They need to treat those lesions correctly. Make sense? Thank you, Hun. Thank you very, very much. All right, guys. Well, listen, it's 3:25 here. I'm going to go over to the lake and take a walk. So I will see you guys later. Hopefully, I'll see you next Sunday. I'll do my best to be here. You just have to understand that I am all over the place emotionally right now because of this breast cancer diagnosis. And I have good days and I have bad days. I have days where I just cry all day because it's just, you know, I worked so long caring for my elderly parents, and the stress was off the charts. And I did my job and I got them through to the very end. No regret. But, last year was hard. You think you're ready to lose your parent. I've now come to realize you're never ready to lose your parent. You are never ready to see your father take his last breath, which I did. You're never ready to hold the cool, cold hand of your mother, which I did. Because she was sneaky. She did it when we weren't at the hospital. She passed when we weren't at the hospital. And that grief is such a strong, powerful force. It is a force of nature. And, I cried for months, every day. And the holiday, the last Christmas was the worst. You put on a good face. I went to my sister's house, tried to enjoy myself. And literally, as soon as I got in my car to drive home, I just started sobbing, and I sobbed for hours. So now the grief is better. And we just passed the 1-year anniversary when I get this effing breast cancer diagnosis. And it's like, really? Why? Why me? Why now? I just worked in your service caring for my parents. And you give me breast cancer. And there is anger. Becky says, I lost my dad in 2007, my mom in 2021. You never really get over it. Yeah, you don't. You don't. But, I was thinking, okay, now my life gets to begin. you know, because I gave up so much for them. It's like, okay, now it's my time. Maybe I can go meet a guy, fall in love, take a trip, take a vacation. I haven't been on a vacation in 20 years. I did not have a night away for 8 years. And so forward to live again. So the tears are real. The anger is real. The frustration is real. But most of the hardest part of all is just the fear of biopsy results. Now, thankfully, the cancer is not known for going into the bile duct, lymph nodes. Knock on wood. But I've got 2 spots not eligible for a lumpectomy. So it is a double mastectomy. And we're just going to pray that it didn't get into the lymph nodes. Because if it got into the lymph nodes, then I'm going to have chemo, which means I'm going to lose my hair. And it's like my hair is the one thing I'm really like grounded by. This is me. It's crazy. So send me strength and support. You know, I was thinking this would be my last meeting. But, you know, if I'm up for it next Sunday, I'll be here. If not, I won't be here because I get to come first now. And I have to come first now. I mean, like I have a lot of life I want to live. I have a lot of life that I want to do. I'm not ready to give up. Cindy says, my word, Joe, we may need to rescue you. I'm praying for you, lady. Stay strong. You're so special. Thank you, honey. A friend of ours, really a family member, Leonicia, who went through this a couple of years ago, and I told her that I was crying a lot, and she said, good, you got to get it out. It's okay to cry. It's good to cry. It's important to cry. So, and that's why I'm doing my breast cancer vlog on YouTube and on Facebook, on my personal Facebook page, not my IC Network page. Larissa says, love and hug from South Carolina. Hang in there. Thank you, honey. Thank you. So my surgery date is July 8th. 3 weeks. 3 weeks. 3 weeks. Boggling. It's just boggling that this is happening right now. That's my story. All right, I'm going to go. The more I talk about it, the more upset I'll get. So now I'm about ready to cry again. So I will see you guys later. I'll hopefully see you next Sunday. All right? See you later. I'm going to say goodbye to Facebook first. All right, YouTube. I see you guys up there. Be well, my friends. Be well. Have a good week. I'll talk to you later.